Today we're talking about stored emotions and the body. So if you've gone to any of my talks before, you know that I do always have like a focus on both our physical and our mental health, because our mental and our emotional health is super important. It actually has an impact on the way that we feel and our physical health, which is pretty cool. So there is scientific evidence that chronic stress can cause health issues like migraines, digestive problems, and even chronic pain. There's been recent studies that found emotions like anger and sadness can result in physical pain, since strong emotions can actually cause an inflammatory response in the body. So I think most of us intuitively kind of know this. When you're not happy, you start to notice like, oh, well, now my back hurts and now this hurts and I don't feel good. And of course I have a cold now because I'm so stressed out. You kind of notice that things tend to go hand in hand. But the really interesting thing to me is that just by changing our emotions, we can actually change our health. So in one study, the researchers found that pain scores actually decreased. I'm sorry, my dog is playing with a rock. Pain scores actually decreased by 52% for people who have like chronic pain when they were happier, and then actually practice like mindfulness and happiness exercises. Whereas those who had like really, really bad chronic pain, it decreased by 35%. So those are pretty intense scores, like 52% and 35% decreases in your pain just based off of your mood, which is pretty cool. So our bodies store emotions when we are unable to express them. And these emotions can then manifest as physical pain or disease. Humans are emotional creatures. We are born knowing how to express our emotions freely. Think babies cry when they need something. You know, they smile, they giggle, they're not inhibited. But as we get older, society, our parents, our, the people around us, our environment kind of influences how we express our emotions. So, for example, in our society, males are taught, be a strong guy. Men don't cry, real men don't cry. So things like that. So they learn to repress some emotions that way. For females, we kind of have that like, don't be too bossy, because it's not a endearing quality in a female. So we don't get to express, if you're a female with like really strong leadership qualities, you might not get to express those as well. So sometimes our emotions can be deemed negative, and we've been taught, don't show that negative side of yourself. And that leads us to repress our emotions. We also experience emotions in a physical way. So what scientists have found that each emotion actually correlates with a physical sensation, and these sensations can have an impact on our health. So this I thought was really cool. And looking at like, where do we actually feel emotions? So researchers took 701 people and they asked them to color in on a body silhouette where they felt specific reactions. And these people were shown different situations, whether it was like movie clips or reading like a little paragraph about something that happened to someone, really just kind of influenced to embody that emotion, that sensation, and figure out where it was happening in their body. And what they found was that people actually had very, very similar body experiences to each emotion. So if we look through this, you've got like happiness, which is felt throughout the entire body, which is pretty cool. And you've got anger, which you feel more in like the upper body. If you think about it, like when you're angry, what usually happens? Your blood like goes to your face, you get a red face. You might feel, some people who get really, really angry will say that they have like blackouts, or their vision starts to black out because all that energy kind of goes up there. And I'm not gonna go through all of these, but you can kind of take a look and just see like where emotions are felt in our bodies. So as researchers did this, they started to realize, okay, something's going on here. And if we look at the next slide, this is a really good tool to use, this like body mapping. That's what it's called, the technique. in order to check in with your physical experiences and your emotional health. Because if you notice, if you have pain in any of these areas that are kind of highlighted, you can look at the emotions associated with it and say, oh, maybe this is connected. And sometimes, if you were in a car accident and you really got, like hurt in your neck and you have pain in your neck, it might not be due to having, burdens or whatever else is going to cause neck pain. That's on the emotional side. That's going to be a physical problem. But for people who have pain where doctors are like, we've done MRIs, we've done x-rays, we don't know what's going on, we really want to look at this emotional side and see if there's any of these emotions that are correlating to where we've got these issues in our body. So this is really good to do at home. All you have to do is, if you want to print out a silhouette of a body, or you can even just like draw a stick figure. And when you're feeling strong emotions, start coloring them in. So color in where you're feeling those emotions. And you can do it for both positive ones and negative ones, because as you do this over time, it really helps you get in touch and be mindful about where you're experiencing your emotions, so that down the line, you don't store them and you're able to express them. But this is just a little tidbit, like side tidbit, that I thought was interesting. So now we're going to get into the juicy stuff. Where are the emotions stored and what symptoms do they cause? Because when emotions get stored, they can manifest as physical ailments. And that is the main thing that I want to get across to you guys with this talk. So where we store emotions. The first is the neck. And the space around our neck and our throat is really deeply connected with communication and self-expression. So a lot of this actually correlates with our chakras. If you're not familiar with the chakras, this is just like a theory of where energies in our body kind of reside. And there are 7 chakras, starting at the crown of our head, going to our third eye, our throat, our heart, our solar plexus, our sacral, and our root chakra. So a lot of these you'll see kind of correlate with these areas, because it's all about expression, how we're able to express our emotions. So again, the space around your neck and your throat, think you need your throat to communicate, is all about communication, self-expression. Most people who hold tension here in their necks and their throats tend to be holding their tongue. Maybe they're not allowed to say what they want to say. Maybe they have an opinion that they're not allowed to express, or they might not be able to speak up for themselves. So imbalances can also manifest in thyroid problems, because your thyroid is right here, swollen glands, and chronic neck pain. So if you're someone who has any of these things and there's no physiological reason for them, you might want to look at, is there something that you want to say that you're not saying? For the jaw, we've got emotions of anger and resentment. Think about when you're angry. I kind of just talked about this, but you might like clench your jaw, be gritting your teeth, really like grinding your teeth almost. So you might also have like a sore throat, mouth ulcers. That could all be a sign that you're very angry or resentful. If you think about Ayurvedic medicine, which is an ancient Indian practice, heat is typically associated with anger, and also the liver. So anything like heat, we've got like these mouth ulcers, sore throat, like that hot inflammation, that could all be anger related. Next, we look at the shoulders. And many modern day shoulder issues, unfortunately, are due to unhealthy posture, because we are on computers, we're on technology, we're sitting at our desks, we tend to kind of slump over. But they could also reflect being overburdened. So think of like having a lot of weight on your shoulders. If you have a lot of things that stress you out, too many things to do in a day, not enough time, you're really just overburdened with work, that's all putting weight on your shoulders and can cause shoulder pain. And what we see a lot, especially with patients, is when someone is super stressed out and they're coming into you because they're having a lot of pain or just feeling really weighed down, but they can't figure out like what physiologically is causing it. A lot of times it is due to stress, but it can also be due to hurt and heartbreak. So think about when you round your shoulders. When you do this, you're almost creating a cage. Imagine if you had wings and you were going to round your shoulders, your wings would be wrapping around you, kind of protecting you in this like shell. So that's almost like this subconscious attempt for you to form armor around the front of your body. So if you've been hurt by someone recently or had experienced heartbreak that you haven't truly healed from, you might find yourself having some shoulder issues due to that subconscious, forming of an armor. Next, we can move on to the chest. So this area often relates to powerful feelings of love, grief, and depression. So that weight on your chest, if you've ever felt so sad before, it's just like this heavy pressure here. So when it's tight, blocked, or imbalanced, diseases of the chest, things like cardiac conditions, lung conditions might be present. Interestingly enough, when a significant other passes away, especially in older age, you tend to see the other person pass away pretty quickly after. And we always call that like broken heart syndrome, especially in the hospital, when you see elderly couples passing away very soon after each other. And that's because of that grief, that depression, that sadness causes some real true like cardiac conditions. Usually it'll be a heart attack or maybe like congestive heart failure, something along those lines. Then we get to the hips, and the hips are all about your like pleasure, your creativity, especially related to sexuality and your relationships as well. We tend to store a lot in our hips and our pelvic areas. So stiffness in your hips can really be a sign that you're uninspired in certain areas of your life, or maybe you're overdue for a check-in with your creative outlets. So if you've been work, yes, if you have an office job, sitting in a desk is not great for your hips either, but maybe looking into where can you express yourself creatively, whether it's drawing, painting, dancing, maybe you love to just take nature walks, whatever it is that is a creative outlet for you, look into that, because storing all of that unexpressed creativity in your hips can cause a lot of pain and tightness. Now we get into, this is more based off of Chinese medicine, off of your front side, your back side, your right side, and your left side. But really, the back side of your body reflects like your private and unconscious elements in your life. So think like back is behind you. We try to keep things, hidden that we want behind us. So this is all the things that you store that you don't want to deal with, or that you don't really want other people to see. And a lot of times this can be negative emotions. They can get stored along your spine and the backs of your legs. And some really powerful emotions like anger and fear. Depression is also stored in your lower back. And it's important to keep these in mind, because if you're someone who experiences emotions very strongly, especially if you consider yourself empathic, where you can kind of feel emotions from those around you, you might take those on and really store them along your spine. And that's when we tend to see a lot of these chronic back issues that don't really have an explanation. You might have, like the doctors have ruled out like a slipped disc, herniated discs, scoliosis, things like that. And there's not really much that they can see that's going on in there. A lot of times it is emotional related. Then we look at the front side, and this is your like social and public self. So this is the part of you that the world sees, the part of you that you want the world to see. And it reflects the aspects of yourself that you deal with on a day-to-day basis. So this is things like communication, desire, love, happiness, even sadness, because we talked about the chest is like that sadness and that grief. So these show in things like your face, your posture, your body language. If you notice you're having a lot of tension on the front side of your body, it might be important to address what emotions are you projecting out to the world. Of course, we want to project out, those happier, positive emotions, but life is not always happy. And it's important to look and see. You can express some of those more negative emotions, things like sadness, grief, depression. But when you project them out to everyone around you, if you've ever like standing next to someone who's just so unhappy and you're like, wow, I can't even be this close to you because you're just pushing it off on everyone else, that's when we tend to see some like pain, some tightness in the front of the body. And that's what you want to be careful for. So now we've got the right side, which is like your organization. This is what moves you forward and into the future. And it governs how you interact with the world and correlates to yang energy. So problems on your right side might mean that you are feeling stuck or unable to move forward, or like there's too many other factors at play. You can't do what you want to do. Or you might be experiencing change and that you're really reluctant to, going with the process of that change. You could be having some fear around it. Maybe it's not a wanted change, whether it's having to move or something like a divorce that you didn't want, or a change of jobs that was unexpected that you didn't want. Something like that might manifest as physical pain on the right side of your body. Then we have the left side, which correlates to that yin energy. So this really responds to stimuluses in your environment. So it holds on to your past experiences and your emotional self, whereas the right side is more of that like organized self. You've got the more emotional side over here. And this is dealing with like your memories. So if you have trauma from your past that you haven't fully dealt with, you might experience it more on the left side of your body, probably on the back left side of your body. Or any type of emotional joy or pain, you might feel more on the left side. And if you think about it in the sense of like where these emotions are going to come from, so that more of the emotional joy you might feel on the front side. Your heart is slightly more towards the left. So that's like that emotional, like your heart is swelling, it feels so big in my chest kind of thing. Whereas the memories and past experiences are going to be more on the back. That could be like shoulder, lower back, things like that. So imbalances can also manifest as like specific symptoms. So sometimes, stomach cramps could be because you ate something bad, but there are people that deal with intense pain throughout their body that might not have a really good explanation. We see this a lot with the digestive tract, like so often, because there is a very strong gut-brain connection, and emotions, kind of get processed by the brain. We do tend to feel them throughout the body, but that gut-brain connection really makes a lot of emotions manifest in the stomach. So things like irritable bowel syndrome, that is like pretty much purely related to your emotional side, and how when you eat food, the neurotransmitters and the hormones being produced due to the emotional issues are interacting with that food and causing some indigestion and some pain there. A lot of patients you see will have irritable bowel syndrome, and it's when they're stressed out. It's when they've got too much on their plate, when they're trying to eat and do a million things for work and get it all done and barely have time for themselves. That's when we tend to see a lot of these things. So stomach cramps can relate to fear. It can also relate to anxiety and that overburdenedness. Acne, we tend to see with little anger, so a little bit of anger. So think pimples are kind of like a small outburst from your face or your back, whereas anger can have these like small outbursts of just like yelling at someone, or like that snapping on someone really quick is very similar in that concept. Asthma or chest pain, we see a lot with sadness or grief, a little bit of anger as well. So a lot of times with children, we'll see asthma pop up around the same time as like a parental divorce, or the loss of a pet, or a move where they had to leave their friends. That's when we tend to see a lot of asthma coming up in childhood. Shoulder pain, we talked about, is like carrying those burdens, really feeling weighed down, having too much on your plate. Back pain, we already talked about, as well as like that sadness, that depression. Constipation can be due to holding on to the past. So if you're someone who wakes up constantly thinking about that thing that you did 20 years ago that you still haven't forgave yourself for, and you deal with chronic constipation, there's probably a link there. It's really important to make sure that we let go of past mistakes, we forgive, we let go of things and people and situations that may have hurt us, because holding on to them ultimately only hurts us more. Jaw problems, again, due to anger, especially if you find yourself clenching your jaw a lot at night. If you're very angry or really stressed out, you might grind your teeth. Sore throats are anger, feeling like you can't express yourself. That really relates to that throat chakra and not being able to express. Tinnitus, which is ringing in the ears, can be a refusal to listen or stubbornness. So if you notice that, you've had tinnitus lately, it kind of came out of nowhere, see if there's a message that you're not listening to, whether it's from your family, from your peers, from the universe itself. Just see if there's something that you're missing that you're kind of refusing to incorporate into your life. And then hips, again, like sadness, anxiety. We tend to store a lot in our hips. They are, a lot of people have hip inflexibility, and that's due to a lot of emotions being stored there. And you'll notice if you do exercises, which we'll talk about in a second, but some people get a very strong emotional release when they're working on their hips. If you've ever had a massage or some physical therapy on your hips, you might have experienced a little bit of an emotional release or some emotions coming up. So how to heal? I think I've convinced, hopefully most of you, that emotions are stored in our body and they can have some pretty negative effects on us. So what can we do to help release these stored emotions and prevent storing them in the future so that we don't have to deal with these chronic issues that otherwise don't really have a fix? I get so disheartened when I see these patients coming in and out of the doctor's offices, getting, medications and pain relievers that just aren't working. And next thing you know, they have chronic constipation because maybe they've been taking a really strong pain reliever for months at a time that's not working, and now they've got all these other issues and side effects down the line. So working on it from an emotional standpoint can be really effective in helping us not have to deal with medications that can cause supplements that aren't working anyways. So the first step is to recognize and to have that self-awareness. So that's why I put in that body mapping exercise and just showed you a little bit about that research, because that's a really great thing to do. Recognize where you feel emotions and recognize that you have emotions. Some people have been taught to repress their emotions for their entire life, that when they experience things, it's like foreign. It's almost weird. Like, they're like, what is this feeling? Is this happiness? Am I sad? Like, if you've ever seen someone who's crying and they're like, I don't know why I'm crying, I'm not sad, I'm just happy, it's because they haven't had that overwhelm of emotion. So really recognize it and feel it in your body. Pay close attention and practice mindfulness, which is a really good way to do that. Mindfulness is through that body scanning, that body mapping practice, to acknowledge what's coming up for you. So notice what's happening, accept it, feel it without judgment. So instead of having that mindset, I think that most people have been ingrained with, like, yeah, this is really sad, just suck it up, or that hurt, gotta move on, like, just put it in the past. We're kind of repressing it and not giving it the time of day to be fully expressed. So really just accept it, feel it without judging it. If you feel super sad after watching a movie, don't make fun of yourself. That movie had an effect on you. That's okay. If you're crying because your kids are finally, you're an empty nester, they're finally out of college, or they're going to college, and you're realizing that you're going to be entering this new phase of your life, let those emotions come out, whether it's crying, whether it's laughing, whatever it is. Accept it, because acceptance is liberating and it allows you to live in the present. Sit with your eyes closed and tune into what your body feels like. So whenever you are feeling an overwhelm of emotions, let yourself sit in it for a second. If that means that you need to excuse yourself to the bathroom, then that's what you have to do. but making sure that you get to express and feel those emotions properly. And step 2 is to respond. So our emotions need to be expressed in order to be processed. And we've been so ingrained as a society to experience our emotions for a brief second and then push them down. Get back to neutral so that everyone around us is happy. We're not making a scene. We're not making others uncomfortable. Stay neutral. But feeling your emotions is really important. And that may involve crying. It may involve punching or screaming into a pillow. Maybe for you, it's going for a walk or doing some yoga or some other action of release. Maybe it's laughing out loud. Whatever it is, the goal is to move the energy of the emotion through and out of your body to let it go. So a lot of times we'll see, I lost my train of thought. Hold on. Oh yeah, moving energy of the emotion through and out of your body. So emotion is just energy in motion. That is what I wanted to say to you guys. All right. So energy in motion. If we get that energy and get it stuck because we haven't been able to process it, it's not going to be happy. We want to get that energy moved through us and out of us. And journaling is a really good way to do that. It's really awesome for healing yourself emotionally. You can write literally anything. And people who aren't into journaling, when you first start out, it might be, you know, today I had a good day, the sun is shining, my grass is green. It might be simple things like that. But as you practice and as you continue to journal, you're going to find yourself giving your inner feelings a voice. So it might start from you writing superficial things or writing what you see around you just because you have nothing else to write. And that turns into the trauma that happened when you were 3 that you repressed and didn't even remember, and now you're writing it out. It helps us make sense of what's happening within and gain perspective on our emotions and our feelings. Writing can also help detach us from our fears and hurt and just let them go. So a really good practice is, if you're into trying to let things go, is to write down some things that bother you, something that's upset you, something that's been on your mind for a while, and just throwing it in the fire and letting it burn and saying, you know, I forgive you, I release this. Because that's really, when we don't release our traumas, when we don't forgive the pain and the suffering that either we've caused to ourselves or others have caused to us throughout our lives, we're holding on to all of that. Your body stores everything. It remembers everything. And just to prove my point scientifically, people who are African American, who are descendants of slaves, have higher blood pressure because they're descendants of slaves. Their body, their genetic code has literally remembered the stress from their ancestors and brought it to present day. So I swear to you, your body remembers everything. Whether your mind does or not, your body, your genetic code stores all of that information. So it's important that we release what's not serving us, what's not keeping us healthy, what's not serving our highest good, so that we don't have to carry it around and cause disease. And step 3 is to reset, because it's not enough to just let it go. We want to make sure that we are doing what we can to reset ourselves, to make sure that we have those self-care practices and really just embrace like balance. So the goal is to realign with your authentic self, getting back to a relaxed, open state and embracing wellness and balance. This is things like that face mask, going out to meditate, taking a walk, having a bubble bath, reading a book, enjoying life's little pleasures, that are meaningful to you, because these habits bring out those feelings of well-being. And if you ever heard someone say, you know, smile, it'll improve your mood. It does. It physiologically does. When you smile, you get these endorphins and you kind of trick your body into feeling good. So maybe for you, what makes you smile is going out and working in your garden, or listening to the birds sing outside, or watching your favorite TV show. whatever it is, get those little pleasures in life that are going to make you smile, that are going to boost your mood, because that's going to help you heal as well. So making these self-care practices a habit, something that you do daily, something that you do weekly, is going to not only help you process your emotions, but it's going to help you deal with emotions that come up in a healthier way. So someone who's constantly angry, who's constantly upset, who has is dealing with anxiety and depression, and maybe they trip over their shoelace, or they dropped their water bottle getting into their car, or they spilt their coffee in the morning. To them, that might be a huge deal because it's just one more thing on top of the 100 other things that they're dealing with. So to someone who's in a good, happy state, might be like, oh, I spilled my coffee. That's okay. I'll get a new one. Or I'll clean it up and go change my shirt. No big deal. I might be a minute late for work, but that's okay. I'm on time otherwise. They're not going to process it the same way as the person who's like, oh, now I need to go do here. I'm going to be late for work. This is terrible. Now I'm stuck in traffic. Now I have to change my whole outfit and I don't know what to wear and I don't look good. And today just sucks. I want to get back into bed. You can see the difference between those two different mindsets. And then when they get to work, maybe they snap on someone else and ruin their day. And then that person goes home and says, oh, so-and-so is so mean to me at work today. And now they're mean to their spouse. It's that chain reaction of, I don't like to say the word negative, but really those like negative, lower vibrational energies that happen. Whereas when we have these self-care practices and we're feeling good and we do what we can to up-level ourselves and embody that happiness, that love energy, then, when something goes wrong, we kind of take it for what it is and we move on. And, you might end up having that chain reaction down the line because someone who has a good day at work compliments your coworker goes home and says, oh, so-and-so was so nice to me. They complimented whatever, they're feeling good. Now they're nice to their spouse, who's nice to, their parents, whatever it is, it goes that chain reaction. So thinking about it in that like long-term, big picture thing, it's really important for self-care and putting yourself in a state so that you can better deal with the negative emotions that ultimately everyone is going to see at some point in their life. So a few other ways to release these stored emotions, including meditation. So meditation is great. It helps you become more present. It's a conscious release of muscle tension. And there's a ton of research on meditation that showed it helps with blood pressure, it helps with pain, it helps with your mindset, it helps with concentration, it helps with your brain. Like there's 1,000,001 benefits to meditation. So that's a really great way to help release those stored emotions. As you are sitting and meditating, whether it's guided or you're just focusing on your breathing, one thing to really pay attention to is where in your body can you feel tension? If you feel tension in your hips, trying to send breath there, seeing what comes up for you. When you're in that state of meditation, you're not purposefully thinking of something outside. You're not thinking of the homework or the lunch you have to make for your kids or where you have to be tomorrow at noon. You're not thinking of that. So paying attention to see like what pops into your brain. If you feel tension in your hips and you send breath there, and then next thing you know, this thought of, oh my gosh, I'm so sad about whatever pops up, you can take the next step and journal about that and try to heal through journaling. Next is breath work. Similar to meditation, but breath work is more focused on actually using your breath. So with meditation, you're consciously trying to regulate your breathing, but with breath work, it's a little bit different. There's lots of different techniques. You're actually inducing a hyperalkalized state, a hyperoxygenated state into your body. And this can help with emotions. It can actually, if you're doing like a Wim Hof method, it has a whole other slew of benefits for your physical body that can help release pain, can help release stored emotions. People do tend to have some pretty profound experiences with breath work, and it's a little bit more intense than just simply meditating. Massages are also great. So massages can help reduce that muscle tension. And even if you don't have access to a massage therapist, you can do this at home. There's those Theraguns that are pretty popular now. There's also things like foam rollers or acupressure mats that are pretty effective. And these just they pinpoint the area around where you're experiencing that pain and send blood flow there, which is going to help improve with healing. But also massage puts you into that state of just like calmness. And when you get into that state of calm, anxiety reducing, you get to lower the inflammation in your body. And you can see what comes up again, paying attention to your mind and what comes up and what feelings come up for you. Stretching is also great for emotions. I really recommend Yin Yoga. It's a really great way to release any emotions, especially in the hips. I've been to Yin Yoga classes where we do hip poses and people they cry involuntarily because it's that effective for releasing stored emotions. There's also, with Yin, if you're not familiar with it, it's a much slower form of yoga. So it's more mostly groundwork, not all groundwork, but you're mostly on the ground and you're in positions for a long time, between like 1 to 5 minutes. And when you do these, you're letting whatever you're working on, you're letting that muscle fascia really release and open up. And that can help release stored emotions. It can also help release any pain and improve flexibility. And lastly is art therapy. So this can be any type of art, whether it's like musically related or painting, drawing, sculpting, any other method of self-expression, whatever it is to you, whatever art is to you, maybe it's knitting, but really helping express yourself and express your emotions. So I love paint because it's one of those things where if you're happy, you can paint a beautiful sunrise, sunset, rainbow, whatever you want. And if you're angry, you can just throw that paint against the canvas and really express any anger, any frustration. And no one ever has to see it. You don't have, you can express yourself and then the next day paint it over white and do it again. No one has to see that. It's fully for yourself, fully personal, but it's just a really great way to get those emotions out. And lastly, really important, just be gentle with yourself. So muscle tension can add to our inner voice, and that actually causes more muscle tension. So if you're someone who, for example, going back to like the yoga, if you're someone who doesn't like to do yoga because you're quote unquote not good at it, maybe yoga's not for you. Or maybe as you start off, you just keep in mind, you have that mantra of, I'm not doing this to be good at it. I'm doing it to help myself. And keeping those like gentle self-thoughts, those positive self-thoughts, helps to break the cycle of like that negative body, mind, like feeding itself, of just that I'm not good enough, everything around me is terrible, that kind of mindset. Because that's really, I think, what most people tend to, when you actually go deeper into what's happening, what these emotions are that are causing these pains, a lot of times it ends up being some trauma, likely from childhood, and the stories are always the same. It's, I'm not good enough, I don't deserve this, those types of stories. It takes a lot to get there and to figure out which story is exactly yours. But breaking that cycle and giving yourself all the self-love that you can and the positive words in your own head can be really beneficial. Another thing that I didn't put on here that I will mention is if anyone's ever done the float tanks, those can be really healing. It's recommended that you do it at least 3 times to get the benefits from it. These are sensory deprivation, so it's a totally black float tank. You're not touching anything. You're not hearing anything. You're not seeing anything. And that's supposed to really help you reach these like deep states of peace and muscle relaxation. And if you do have a lot of stored emotions, that might be something to try as well, that can help with that. So I will open it up for a Q&A if anyone has any questions on this. I know I kind of threw a lot of information out there with you, but it's really interesting to see what pain or suffering you've been experiencing in your body. And pretty much anyone I talk to has said that they've had some type of pain somewhere and they have no clue what's causing it. So it's really cool to look at the emotional side and see if you can dig deep, journal, meditate, whatever it is, and see what comes up for you.
If anybody has any questions, feel free to type them in the chat, or if you'd like to unmute your mic, you're very welcome to do so. Excellent, excellent presentation. The other thing too that helps is actually having a pet with
Yes.
building up
Yes.
the mood and lowering blood pressure even, because they're always getting into little fun things. Let's see, we have a couple of messages. Let's see. Christy sent a message.
I can share the slides if you want me to email them to you, Stephen.
Certainly, yes, yes, and I'll send it out, the slides out to everybody that was on the call today. The question: have you heard of transference of pain before?
Yes. So I was just responding to this. With pain, especially if there's any type of like triggering before it, like depression or any type of injury or accident that's more emotional, we'll call it trauma or depression. You can have pain that, in this case, if it was from an older injury that you thought was healed, yes, it'll come up. Or it's I don't know how to explain this. It's very similar to what I was saying when your body's like your body knows everything that's happened to you. Your body has this memorized. So you're gonna see like different pain coming up. It might be in a different place, but it's being activated from whatever that trauma or depression or whatever is going on is gonna activate that pain, if that makes sense. So for example, a good way to look at it is if you are an amputee. A lot of people who have had a limb amputated, they will still feel that limb. They still feel it. You have sensors in your brain that are correlated with that part of your body, and even though that part of your body is not there, those sensors in your brain don't go away. So you might still feel excruciating pain in the limb that you don't even have, which is really interesting. So it's very similar to that, where you have these, pain is almost like memorized. It's like muscle memory pain that your brain has stored, and you might experience it in a different part of your body. Did that answer your question? Okay, great. Sorry, Christy. No, that was like a roundabout way to answer that. But yeah, it's very interesting. Your body stores so much. Does anyone else have any questions? I will say one of my absolute favorite ways to deal with stored emotions is through Yin Yoga. I've had so many patients that I recommended to, and the results are unbelievable, because not only does it help on that emotional level where it's really releasing the muscle fascia and anything stored in it, it's helping on the physical level where sometimes pain, like I said, it's not just emotional, it's not just physiological. In the example of a car accident, if you have neck pain, like, yeah, that's probably because you have a physical injury from a car accident, but you might also have psychological trauma from being in a car accident that can add to that pain. Whereas if you were told by your physical therapist you've been doing everything that you're supposed to do, you should be experiencing relief by now, then you might want to look at the psychological side. So yin yoga is different because it's very slow. So you're going to be in a position, you're not doing like downward dog to upward dog to the warrior poses. It's not like that. You're mostly on your mat. You're doing a lot of like child's pose, and you're very supported. So it uses a lot of bolsters, a lot of blocks, a lot of pillows, a lot of blankets to keep you comfortable in these different yoga positions, and you stay in that position for about 5 minutes. So when you're doing yin yoga, you give your body the time to relax into the pose. You're not, it's not much of a workout. It's more of a stretch and really focusing on letting that muscle fascia release. It can be a little bit, I don't want to say painful, because you don't want to be in pain when you're doing yin yoga, but you can definitely feel a little bit of discomfort. But the longer that you do it, it improves your flexibility a ton. And that's where it has those physiological benefits as well, because after time, after doing it for a while, releasing the emotions, but you're also improving your flexibility, which in the long run is going to help prevent other injuries from happening. Yes, it is gentle movement. So you can look on YouTube if you've never done it before and you want to see if it's for you. There's some YouTube classes that are great that don't require a ton of props if you don't have them. But my favorite is always doing yin yoga in person with the yoga instructor, because they can help you modify things. Some of the poses can be pretty intense, and they can help you modify it so that it's intense for you, but you're not hurting yourself and you're not in pain, and you're able to settle into that pose. Does anyone else have any questions?
Can yin yoga be modified into chair yoga?
Yes, probably. I do believe you might be able to find that on YouTube. Honestly, YouTube is great, but I would say if you are someone who needs a lot of support, I would work with a teacher, like one-on-one, to try to do some yin poses that can be modified into a chair. I know that if you're able to, you might be able to do a lot of the poses on like a couch if you were to lay down, if laying down on the floor is too low for you. Because some of them are as simple as just like moving your hips and your back in a certain direction and kind of lengthening the spine. But I would talk to a yoga teacher, like a certified yin yoga teacher, because they would be the best option for modifying. And what bird is calling, I don't know, but it's here every day and it's very loud.
Well, I thank everybody for zooming in today to today's presentation, and I thank you, Dana, for presenting a wonderful, informative program as usual. And everybody on the call today will get the slides that were shown on the screen. Everybody, I hope everybody has a great rest of the day and a wonderful weekend. Enjoy.
Thank you guys. Thanks for everyone showing up.
Bye-bye.